Jason Renault again with the Alternative Mobile Services Association. And today I'm here with Ben Winger from the New Orleans Public Health Department. Welcome, Ben.
Well, hello everyone. Good afternoon.
Ben and I met just a couple weeks ago at the Alternatives Conference up in New York City. And I was intrigued and informed by his telling a little bit of his story of his career. And I wanted Ben to come back and say it in a complete way so we could hear it from the beginning, middle, and end without interruption. And here, Ben, how did you get started in this line of work?
Well, it all started in I would say 1983. I was 18 years old, young, wanted and I joined the sheriff's department in the city of New Orleans. And that's where it all started when I became a deputy sheriff. And I did that for about a year. Um, it was I did subpoena capias, basically residential uh, incarceration, uh, transportation, court security, and things like that. Uh, and from there, I got interested in security work, but it wasn't quite. I could do it, but I was looking for something a little bit more specialized. Um, I started off in the academy at the sheriff's office, but then I got interested at 19, uh, and I heard about actually it was my mother who told me, "Well, son, would you like to be a paramedic?" She was reading the paper, and she said, "Like those guys on emergency," and I said, "Sure, I'm interested. Where do I have to go?" So I went to you know, a local vocational center, and I became an EMT. And from there, I worked private industry for about 3 years. And then I got on with the New Orleans Health Department. Uh, and I began my 911 career or in that area. And basically during the cocaine epidemic hit us, where we went from maybe, I don't know, maybe one gunshot a night or a week to almost every day. And I got a lot of experience in trauma. Uh, basically, the ER at Charity Hospital, uh, and really got immersed into the emergency uh, response, industry. From there, uh, most of us that are in EMS, either we go police or we go more into the medical field. It's a high stress job being a medic. I became an advanced medic and just kept moving forward. Wound up, and at that time, 911, the call center, everyone had their separate call center. Unlike now, it's everybody is together in one building. And back then it was and police department had their dispatchers, EMS had their dispatchers, and we would rotate uh, in and out of dispatch with fire alarm. And I became the senior systems statistical manager for EMS, and that's when I got introduced to the data and you know calculating the data and while I was there, you know, rotating back and forth, you know, I became a single parent and they kept me up there because I couldn't work the 12-hour shifts, so I had to work 8-hour shifts. And I still wanted more. I still felt that I could do more than just uh, EMS. I wanted a more stable career path. So I was looking to going back into becoming a police officer, and I wound up taking the state exam and becoming a state campus police officer for the city. I mean, for the state of Louisiana at Southern University, where I started that career. But always in the back of my mind, I still wanted to become an RN. But this was the means to do it. So, uh, I recertified as an EMT, uh, campus police officer as well. Uh, and I also enrolled in nursing school at Charity School of Nursing. From there, because they're basically, you know, in this field, in the emergency response field, you do a little bit of everything. You do a little bit of crowd control, you do a little bit of policing, you do a little bit of medical, it's all related. So it really wasn't a big jump to go to either one. Uh, so I spent so much time in the ER. So when I graduated from nursing school, immediately I went into med surge, and anybody knows that Charity Hospital, they've been in existence since 1736. So we've been nursing for quite a long time. And so it was it's like a city within the city. And I enjoyed working at Charity. But once Charity, and I worked all over because in nursing, if anyone knows, they're always short. So sometimes I work the ER, sometimes I work pediatrics, sometimes I work step downs. So I really got immersed into the nursing field, um, and in just clinical management and nursing care. And sometimes we would have like, you know, I would be the charge nurse for 40 something patients in one wing, including the med surge wing. I mean, including because we did service the whole state. So sometimes the prison ward and four other wards, uh, I would be the charge nurse for that, medication and manager of care as a treatment team. So then, you know, I said, I wanted to try something else. I was doing advantage care. I was as a nurse, and I started working with in other modalities such as uh, transplant and uh, and mental health. I got involved in mental health care, geriatric psych at Kenner Regional when I was going from hospital to hospital. Uh, so I wound up said, well, I really liked psych and dealing with psych. So uh, I said, well, let me go focus. And when a psych opening came up on Charity's uh, infamous third floor, I said, well, let me go over there. Uh, kind of had my fill and burnt out on on med surge. And that way, I figured I knew if I went into psych, they wouldn't pull me all over the hospital. They just leave me in psych because nobody wanted to go there, So, and that's where I began my psych career, although it really began earlier in EMS because we had those issues as well. Um, and, I also had family members that had psychiatric issues. My father had psychiatric issues. So I was always somewhere in there, So, and once I became the charge nurse at the CIU unit, which is the crisis intervention unit, um, I worked at Charity Hospital for 10 years, and 6 of those years was in psych. But once Hurricane Katrina hit, they closed down my beloved Charity Hospital. And I really couldn't see myself at that point. The average nurse lasts about 7 years before burnout, and I've lasted 10, so I've been doing pretty good. Still looking for something else to do and to settle down in. I didn't want to go into nursing management. The nursing field is a tough field, and all the nurses they get in and then they're trying to get out of it, you know. So I was one of those guys that found a way to. I tried my hand at. I said, let me go back to school after Hurricane Katrina. So I went back to school and got my bachelor's of arts in psychology. Uh, and from there, I also got a degree, associate's degree of applied science in biomedical technology. I got the biomedical technology degree because my dad used to be a Navy electrician. He took me out on jobs. So I really had a understanding of electricity and electrical stuff. He worked my hands off most of the time, but I had a good time, you know, uh, so I was his little helper. So I branched off into the medical electronics field, where when they built a new hospital, I worked over there for over a year and in Slidell Memorial as an apprentice. And did a lot of repairs of biomedical equipment, uh, all types of equipment that you can think of, anything from a stretcher, operating table, autoclave, you know, network type, I guess it would be like monitors and defibrillators, titrating IV pumps and things like that. So, and repairing them, I always was a tinkerer. If you come to my house, I'm tinkering on something. So, um, I done pulled apart something, or I actually rewired my whole house. So after Katrina, and so I was very good with my hands, and my family is like that. You know, somebody's a carpenter, somebody's a plumber. They always took me on the road with them. So so after that, I couldn't get a job in that field. They privatized it, and it it wasn't as lucrative as and but all the while, a friend of mine said, "Hey, why don't you come and get uh, your master's in psychology?" And I said, I'm kind of burnt out on school, but I remember one of my instructors, uh, she said, if you're going to get into psychology, the best thing to do is industrial organizational psychology. That's a better field for you to get into, where you can, because she noticed too that I had all this experience in the medical profession. I could really help develop and change the system, she said, instead of just individuals and helping individuals, I can actually change the system. Well, as a black man, I'm always interested in changing the system, right? So uh, I think it could work better for us in my community. So I said, okay, I'll do it. So I went to Walden and got my master's of science in industrial organizational psychology. And from there, I was working in various positions. I didn't work as a nurse anymore. I didn't want to do that anymore. I wanted to work out in the field. I worked with a lot of social workers back then in the ER and and at the hospital. So I started doing outpatient type IOP uh, type work with social workers, and really got into the social work field and case management and things like that. Well, one day the city calls me. I put in an application for the city. I passed all the tests, and they said, "Well, hey, would you like to come work for JJIC, which is a juvenile intervention uh, department, and helping with the kids?" Well, of course, I wanted to work with the kids, but I didn't know how bad these kids were. They were real bad. Some of them were anything from murder to breaking into a car, you know. But I became a reentry specialist, case manager for these children, where I would go out and do curfew checks and do all sorts of and it was very fulfilling. I had a 50% success rate in them not in recidivism, that they did not return. So I was really good at it. And then I get a call from the city, and a year later, and they said, "Hey, we're starting this program called Alternative Dispatch, and you seem to have all qualifications that we, we use to help develop this program. Now, mind you, I thought I was going to change the system. I didn't know I was going to be creating a system, and this intrigued me even more. So I said, well, let me go work for the health department once again. The health department, EMS used to be under the health department, and to a certain amount, they still are. So I'm going to go back to work with the health department and help develop this alternative dispatch, you know, program. And that's when it all began, and that's where I've been ever since. So it's always been in the medical field type, application, emergency response. So, you know,
It sounds like you were getting ready for about 25 years to do what you're doing now.
it does. It does. I didn't know, sometimes I stayed in that arena, but I didn't know where I fit. It's sometimes it's hard for black professionals to find their niche. Uh, you know, I dealt with a lot of in the medical field, there is a lot of you know, racism, um, professional racism, I would say, and competitiveness. Uh, but my main stead focus was how can I help my community? Because there's healthcare disparages in my community that I witnessed. Sometimes I would do uh, maybe 2 or 3 gunshot wounds a night, and I come home because I stayed in the hood and do one at home, uh, do one around the corner. They all knew me as they called me the witch doctor in the neighborhood. So
They knew
call
who
the
to
witch
call.
doctor. Huh?
They knew who to call.
Yeah, actually, a story to tell you. Uh, a lady who was staying in an abandoned house who was a cocaine abuser. Uh, she heard about me. She was pregnant, and she knocked on my door, and she lay down on the steps, on not on my steps, but right at the edge of my steps, and she's having a baby. Me and my mama are in the kitchen drinking coffee. Jesus and coffee, talking to your mama. I'm a single parent. The kids are at home with me. You know, and I get this bang on the door. Ben, come out, come out, come out, and there she is, crowning in all her glory. And that's how my children found out it was not the stork that brought the children here. So I delivered the baby right on the doorstep. But excuse me. But I've delivered several children in EMS field. So it wasn't really hard to do. It was just that, and it was just that, you know, just get in there and do it.
What a blessing to know what to do, though, and that she chose you to do this important thing for her, to birth her child.
Yeah, we kept in contact. She's not on drugs anymore. She's totally turned her life around. Uh, everyone in the hood
So
knows the
you kept
story.
track of her.
Yeah, we kept track of each other. We all grew up in the same area, Before crack hit, we were all just kids and going to school, playing in the band. I was more science and they were more musical or whatever. And a matter of fact, a lot of my friends went on to win Grammys. The Rebirth Brass Band won a Grammy, and I used to hang with them in the French Quarters, peddling nickels and dimes, playing music with them. And I'd have my truck, so I'd bring them back and forth in there and stuff like that.
Anybody with a pickup truck is a welcome friend in the music
Oh
business.
yes, you know that.
Tell me a little bit about, you mentioned professional development and the barriers that Black people, up here in the North, we expect that New Orleans has figured this all out.
Well, yeah, so long as you stay in New Orleans, but the surrounding parishes may not be so nice.
I
Uh,
see.
the medical profession, if there's healthcare disparages, you would naturally assume one of the reasons or one of the causative agents is because there is racism in the profession itself,
Right.
uh, which is reflected in the healthcare disparages as well. Uh, well, just to give you an example, I wanted to go to the ER after nursing school, but that was not available to me. I had to go where they were needed because we signed a contract, because we I had a stipend, and I would, and I had to work for charity for at least a year. And
I
that's
see.
when
I see.
it grew on me. I thought I was going in the ER with all my ER experience, and they threw me in the wolves with the 10 patients per unit and 40 patients in med surg, which is one of the most
That,
difficult places to work.
that's an outrageous ratio. Super
Right.
dangerous.
Well, yeah. Well, I had three LPNs and maybe two two nurse aides. If one of them didn't come in, then I'd wind up hanging IVs and washing patients anyway. But you get used to it and you learn how to manage it, you know. So throw me in the briar patch. I was born there, so like Burr Rabbit, and I just mosey on it. But I thought I would be going to the ER. Some of my colleagues that graduated who were of a fair complexion wound up in the ER off the back where there's more money,
Uh,
or you go to the White House. We called it, all the black nurses called it the White House, which was ICU,
uh,
uh, or with the specialty units. We don't get that as first pick. We get thrown in with infectious disease, but this is not uncommon. Like when tuberculosis broke out, all the black nurses worked tuberculosis. Uh, when HIV came out, when I was a medic, they put me on all the HIV cases to pick up because we didn't know what we was dealing with. We gown up and do
yeah,
and
I remember.
they'd send me and the paramedic. I was just a basic medic. He would put me in the back with the patients while he would drive, and then he'd drive us to the
Don't touch
hospital.
me. Yeah,
Yeah,
I remember
yeah.
that. I remember
So
that.
yeah.
Do you feel that things are changing in a positive direction? Do you feel that the opportunities are more available now, or those barriers are still there, maybe somewhere different?
Well, these barriers. I mean, I don't expect these barriers to disappear overnight since the civil rights movement. Uh, in 400 years of this. But it's not changing fast enough to say that we are a conscious nation. Uh, I think, the healthcare disparages are still here, so the racism is still here. Uh, like my mom said, son, it's hard on a man out here, and it's twice as hard on a black man. So, and it's an unbelievable amount of pressure because the pressure that's involved in being a black man or black woman in the medical field, where life is literally at your fingertips, you have to be the best at all times. Or as a police officer or as a paramedic, you can't afford to mess up, where nothing is ever swept under the rug. It's going to be blown out of proportion if you make a mistake. You will be exploited. And so you have to uh, wear the mask, so to speak. You have to be that professional, uh, and in order to fit in, uh, but you're always on guard that you don't want to say something at the Christmas party that may be misconstrued, or or you'll be out the door, or or you may be working a shift that you don't want to work anymore, or you never thought you would work, and that's where it's hardest. But now doing what I'm doing, I have my boss, uh, Travers, he's a white guy. I love him to death. He's very conscious. He works with me. Dr. Vegno, I worked with her when I was an EMT, so she's the head of the department, and they value my expertise, and I value their camaraderie and friendship. They know what's going on, and so they put me in charge of this, although they're not paying me well enough for all that I'm doing. I mean, I'm doing data management. I'm doing everything. So in development. But they've given me this tremendous opportunity, and I appreciate that because
Well,
it really is. I'm really affecting my community, and the city is like the mayor said it was a chocolate city. Then they arrested his, Reagan for that. But after that, yeah, but it's predominantly I like to say a mocha chocolate city. So we got all kind here, and in the city, but a lot of the suffrage and mental health and suffrages in the area is from my community and my people.
Well, and bless you for dedicating your career and life to their help. Tell me what's going on with alternative, as you called it at the beginning, alternative dispatch. You've been instrumental in designing this. What's the status today?
Well, we thought, well, all the data told us was that we could handle maybe 28, 2,800 calls per year and diverting 28 calls per year. So uh, we have we had our anniversary date on June 1st, and we're averaging more like 3,700 calls.
Okay.
So we have exceeded expectations. We thought we were going to get maybe 25% of the calls, but we're doing 25 to 33% max, but we're getting more like 35 to 37%, sometimes even 40%. Um, so uh, I didn't like the word alternative dispatch, so I changed it when I did the contract amendment. I was handed this original contract, and I made some adjustments as soon as I got the chance. So I changed it alternative because we're not an outreach team, we're an
Right.
intervention team. So
Right.
I'm I renamed it the Mobile Crisis Intervention Team after my crisis intervention unit at Charity. I just put an M in front of it. And then I went to pursue, making sure that they had a CAD system like other first responders, radios, which is our lifeline.
Yeah.
I'd rather leave my gun at home than to leave my radio at home.
Yeah. Yeah.
So I knew it wasn't going to work unless we did this integration. Now I could talk police codes and EMS codes and even dispatching. So I've done all those things. What I haven't done, and this is where Travers and Dr. Vegno really helped me, was system building. In theory, you go to school and you learn it through knowledge, but through experience,
Yeah.
it's a whole nother story. So
Yeah.
this is where I was gaining the experience in contract development, living contract, things like that. And that's where I really felt like this is where I need to be because I'm talking to city council. I went in front of the city council on the 16th for our 2-year anniversary. So, um, and we're looking now to take on over 700 more independent calls with the data management with the 911 system. So, an independent response. Our response team, MCIU, unlike others who 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 try n- who try not to get the police involved, we wanted the police involved because they need the help. And so, they couldn't do it by themselves. And they call us maybe 47% of the time. Uh, you know, and the rest of it is independent calls or yeah, the rest
You're
of them are
getting
independent
calls
calls.
from police officers themselves. You're doing independent dispatch. You've got a crisis number. Do you also get calls through 911?
Yeah, we get our independent calls through 911.
Okay.
Uh, but we have under contract, if any first responder requests our assistance, we will respond within 4 minutes. We'll be on the road. So then that was not my design. That was by the design of Travers. But I just expounded on it. I said, okay, well, if we're going to be first responders, because they want to be first responders. Okay, if you want to be first responders, I will write it up. I found the revised statute that anybody, that can create a first responder, and what is a first responder considered. For example, a lineman for electrical company can be a first responder in the case of a natural disaster. They got to go up there, fix the lines, right? The
Right.
electrical lines. So they are
I
considered
see.
first responders. So under that umbrella, I in getting our city to recognize them as essential employees. And getting RHD to dedicate at least one unit in case of a natural disaster or a disastrous event. They don't evacuate. So we don't evacuate just like first responders. We respond to 911
You're
call
going
just
in.
like
Right.
first responders.
Right.
So that's what makes us considered by the city first responders. Now they become designated, that's a different story.
Now, I think that New Orleans was the first city to adopt this idea that mobile crisis teams were also first responders. Is that your understanding?
Excuse me. Yes, I found it interesting that no one else was doing that. Either they are integrated into the and are first responders, but we are the first uh uh I guess RHD is the first responders that are a private entity or a private company that became first responders. They're not part of the system, so to speak, or the municipal part.
I see. So they're not police, fire, they're not city employees. So explain how RHD fits into the public health department.
Uh, I'm in favor of the mixed method approach with this. I didn't want to, I didn't want our own department because now it's just part of the bureaucracy. And everyone knows the red tape and how slow it is to make changes in the bureaucracy. But with RHD, they're able to make decisions and move quickly. Uh, we insisted that you know, that they pay their people a living wage and that but we wanted that flexibility that a private company could offer. Uh, and we wanted the expertise. RHD been there for 25 years and working in New Orleans. They've already done crisis outreach, but we were more interested in crisis intervention. So with that mixed method, with the power of the health department, and we have many resources, uh, with RHD being a private, you know, program, we're able to move, and we have more flexibility. We're able to move quicker, and uh, in the mental health field, uh, I think it's better that we do have a community response. We're a true community response program. I don't think you're really a community response program no more than you are police if you are part of the municipality, so to speak.
Oh, huh.
So, you know, if that's the case, police is a community response program. Fire is a community response
I see.
program.
I
You see what
see.
I'm saying? So
Yeah.
and in that we developed our community advisory board, which is made up of 9 people. They are also uh, chosen out of the community, and we made with Vera. We developed we have 8 police districts. So I said I wanted 9. Uh, you know,
9 members.
9 members because I
Uh-huh.
didn't want to stalemate in their voting, 9 voting
Yeah.
members. And the non-voting members are police, fire, and OHD, other community programs like homelessness. They're all a part of the non-voting members. And every year, our community program speaks truth to power annually to the Quality of Life Committee with the City Council. So, and their job is to go out into the community. Uh, they want to do surveys. They want to, and basically they're autonomous. I made sure that they develop their own governing charter.
Okay.
Uh, so, and the thing about the governing, I was a member of Psi Chi, which is a honor society for psych, and I developed it while I was in undergrad, and I developed it under that. So they do have a chairperson, they do have a secretary, and they have a parliamentarian. So, I was the parliamentarian in college, so I knew how I wanted to frame it. So, and it's been framed as such. And working with Vera, we've come up with, even RHD is a non-voting member. So, and that's how I gel and keep like my dad would say, it keeps the cheese more binding that way, that we, because we also have every every other week we have our meetings with our with all first responders, and that is a meeting that we have where we tweak, the response. We meet with OPCD, which is the Orleans Parish Communication District, which is our 911 call center,
Right.
NOPD, fire, EMS, and MCIU, for the sake of integration. It's called our I call it our tweak team because we're tweaking, but and getting things tight. But that's how we're developing these calls, looking at the data. I do data identification with Harvard, uh, in identifying more calls that MCIU can possibly take from EMS or from the police. So that's where we are at now,
So
right
you've
now.
gotten a lot of help from the Vera Institute and from the Harvard Government Performance Lab. You've really gotten a lot of outside information here too.
Right. Yeah, they one day they call us, they're interested in what we're doing, and we qualified. So yes, we did get a lot of help from Vera. Vera even helped us in getting donating Microsoft donated the development of our dashboard,
Oh, good.
which mirrors Anise in what is that, Durham dashboard. So I got on the phone with Anise, and it's me and Frankie at Vera, data scientists. I understand the lingo once again. I've worked in statistical management, and there's a lot of a lot of stat stuff dealing with in grad school. So we put together and identified certain calls that we could take over. So we're constantly expanding. Now I'm looking to take on. Now that we've looked at the medical codes, now I'm looking at the police codes and seeing what else we can expand to uh, in independent response. So I predict that our increase in independent calls will increase as NOPD don't even have to go on the scene on some of these calls that they've been going on.
Well, Ben, it's just this has been a wonderful. My brain is full. Thank you so much for spending the time with us and telling us about your career and giving us an update on what's going on with the New Orleans team.
Yes, my pleasure. I'm doing this, and I'm hoping that other alternative response programs uh, can can learn from me as I've learned from them. So it's like giving something back, and to make our communities better and safer. All this started after George Floyd, Breonna Taylor, and all this, but I've been seeing this since childhood. So, uh, but maybe God is part of God's plan for our nation to build this fifth branch, to assist uh, the less fortunate, so to speak, on the suffrage and I know we're alleviating suffrages in New Orleans, so I would like to see that for the rest of my nation. Who wouldn't? You know,
Thank you, Ben. Thank you so much for your work.
you're welcome.